Welcome to the Deep Dive.
All right, let's get straight into it today. We're tackling entropion for revision.
Yep, that inward turning of the eyelid.
Exactly. Our mission is just a quick, clear run through what it is, why it happens, how to manage it. We're using the MSRA notes as our main guide here.
Sounds good. So entropion, fundamentally, it's when the edge of the eyelid, the margin, it turns inwards.
Okay.
So instead of the eyelashes pointing out, like they should, they end up rubbing against the eye itself, the cornea, the conjunctiva.
Right, that sounds irritating. Is it always the lower lid?
It's much more common in the lower lid, yeah, but you can definitely see it in the upper lid too.
And what would someone actually feel? What are the symptoms?
You'd expect, ocular irritation, that
Yeah.
classic gritty foreign body sensation.
Like something's in your eye.
Exactly.
Yeah.
Also, maybe some eyelid twitching, that's blepharospasm, lots of tearing, and just general redness.
And it's important to actually check the lashes and the cornea. Absolutely crucial. You need to see if those lashes are physically touching the eye surface and assess if there's any resulting damage, like an abrasion on the cornea.
Okay, so what actually causes this inward turn? What are the triggers?
The notes give a really handy list. The main causes are age-related changes, tissues losing elasticity, that sort of thing.
Makes sense.
Then scarring, maybe from an old injury or surgery. Trauma itself, infections can do it. Sometimes it's congenital, so present from birth.
Okay.
Also specifically trachoma, which is an STI infection, and Bell's palsy, affecting the facial nerve.
Wow, quite a few things. Is there a way to remember those?
Yeah, the note suggests a mnemonic, ASTTTB.
ASTTB. Let's break that down. A.
Age-related changes,
S.
scarring,
AST.
trauma,
Ice.
congenital,
IE.
trachoma,
MB.
Bell's palsy. Got it.
ASTICTB.
Mhm.
That's actually pretty useful. Okay, so those are the causes. Are there specific risk factors that make someone more prone to it?
Yeah, definitely. Advanced age is a big one, especially being over 60. That links right back to the age-related tissue changes.
Right.
Also, having had previous eyelid surgery, dealing with chronic eye inflammation or any kind of scarring around the eye.
And conditions affecting nerves.
Yes, exactly. Any medical condition that impacts the nerves controlling the eyelid or face, like Bell's palsy again.
Got it. So, pathologically speaking, the lid turns in, lashes rub.
Mhm.
What's the direct consequence?
Well, that constant rubbing by the eyelashes is the core problem. It causes the irritation, the redness, the tearing we talked about.
And it can get worse.
It can, yes. If it persists, you risk getting a corneal abrasion, basically a scratch on the surface of the eye, or even a corneal ulcer, which is more serious.
Okay. So if someone comes in with eye irritation, what else might be going on? What are the differentials?
Good point. You need to consider ectropion first, which is the opposite, the eyelid turning outwards.
Right.
Then there's trichiasis. That's where the eyelashes are misdirected and growing inwards, but the actual eyelid position is normal.
Ah, subtle difference.
Mm-hmm. Also, spastic entropion, which is kind of intermittent and caused by muscle spasms, maybe from irritation, and, just other general eyelid position issues.
How common is this condition, say, in the UK?
The prevalence isn't super well defined here, but we know it's definitely more common in older individuals. Again, that over 60 group pops up frequently.
So summing up the clinical picture, what are the key things a patient reports and a doctor sees?
Okay, so the patient will likely complain about that inward turning eyelid, the feeling of lashes rubbing, redness, irritation, maybe excessive tearing, light sensitivity, and that foreign body feeling.
And on examination?
You directly observe the inward margin, see the lashes hitting the globe. You might even see the consequences, like visible corneal abrasions or ulcers if you use fluorescein stain.
You gave an example earlier.
Yeah, like a 70-year-old patient, gritty sensation, lots of tearing, you look, and the lower lid's turned in entropion is your top diagnosis there.
Seems quite visual for diagnosis. Are investigations usually needed?
Not typically, no. The diagnosis is overwhelmingly clinical. It's based on looking closely at the eyelid position and how the eyelashes are oriented. Specific tests aren't usually part of the workup.
Right. And management? How do we treat it?
It really depends on how severe it is and what's causing it. For milder cases, you can try conservative things first.
Like what?
Lubricating eye drops or ointments can help soothe the irritation. Sometimes taping the eyelid down, pulling it outwards can give temporary relief. Protective eyewear might help too.
But for more persistent cases?
Then surgery is usually the way to go. There are various surgical techniques to repair and reposition the eyelid, tightening the structures to keep it from turning in.
And how do people generally do after treatment? What's the prognosis?
Generally, it's good, especially with treatment. Surgical correction often provides really effective long-term relief and, importantly, prevents those complications we mentioned.
Which brings us to complications. What happens if it's severe or just left untreated?
The main worries are damage to the cornea. So, corneal abrasions becoming persistent or developing into ulcers, chronic eye irritation, conjunctivitis.
And vision loss.
Potentially, yes. If the corneal damage is significant and leads to scarring, that's why treatment is important.
Okay, great summary. So key takeaways. Entropion is that inward eyelid turn, lashes rub the eye, risk of corneal damage. Diagnosis is clinical. Management goes from lubricants and tape to surgery. Remember, ASDC-TB for causes.
Exactly. Prognosis is usually good with treatment.
It really makes you think, doesn't it? How a small anatomical shift, like an eyelid turning in, can cause such significant problems for a vital sense like vision. Makes you wonder what other subtle physical changes can lead to major health issues.
Absolutely.
For more top-notch revision resources, don't forget to check out pastthemsra.com and freemsra.com. Thanks for joining us on the Deep Dive.